is a 43-year-old male, status MVC, with an open type 3A right tibial pilon fracture, a left subtalar fracture dislocation, a left Weber A fibula fracture, and a left tibial plateau fracture. These are the initial x-rays of the pilon. There is a few centimeter wound posteriorly. CT was obtained. The left subtalar fracture dislocation, which was closed reduced, placed into a short AO splint initially. CT was obtained post-reduction. And a non-displaced lateral tibial plateau fracture. The right tibia underwent an IMD and external fixator the same day. And then 2 weeks later, the left talus and distal fibula were taken for an ORIF, as well as a talo-naviculo-cuneiform arthrodesis. And a right pilon removal of X6 and ORIF.
Did you guys look at the joint?
Yeah.
Any thought about sliding up something medially, just because it's so comminuted?
Yeah, so there was thought given to that. I think that the thought process was just because of all the comminution that we just wanted to bridge everything and leave the comminuted areas alone for secondary healing there.
Well, if you slide it up, you're not dissecting it out, you're just adding. So what's the concern? What's the deformity that may develop?
You could go into varus.
Yeah, because all your fixation is laterally, giving you kind of valgus buttress, and you have all your comminution in the shaft and medially. So you have to keep a close eye on it, because it'll, depending on how quickly it heals, it'll slowly start falling into that. And there are papers that show that adding something to prevent varus collapse does help prevent varus collapse.
Is this something you will bone graft in 6 weeks?
I would certainly consider it, Dave, depending on the x-rays.